Hi, everybody, and thanks for joining us for our talk on sleep and diabetes. I am one of your hosts, Dr. Jeremy Pettis. I'm joined, as always, by my good friend and colleague, Steve. Come on, wake up, man. Eric, can we start over? He's freaking sleeping.
We don't have time. Keep going.
All right.
Had a tough night last night, sorry.
Jeez. All right, so we're talking about sleep. Thanks for joining us, Steve. So, is sleep a problem in people with diabetes? What do you say, Steve?
Absolutely yes, for a lot of reasons.
Yes, it really is. So we're going to get into it. What are some of the causes? What do we do about it? All those kinds of things. But we're thinking about, times that we've had issues with sleep, and I don't have to think very far back. I was actually just traveling last week, had an awful night of sleep. Had nothing to do with like the pillow or the room temperature. It was that my blood sugars went low. I corrected them, but they kind of went low again. Then I actually went high. So I was up just multiple times in the night. Didn't really sleep at all. Felt like garbage the next day. And you had something happen just the other night too, right?
Well, I have a bunch of reasons, but I do drink way too much fluids before I go to bed.
And alcohol.
And I said fluids, adult fluids. And I have to get up. Ready for this? It's almost embarrassing. 2 and sometimes 3 times. And I had markedly elevated blood sugar because of my gastroparesis. Went to bed at 160 something. I thought it straight across, and all that late night pasta just hit me, and I woke up at like over 285.
Yeah.
And then the rage bolus, and then you just can't sleep well.
Yeah. So sleep is an issue for all Americans, but particularly for people with diabetes. We're going to get back into some of the statistics, but then we talk about sleep apnea, which is something, different, that up to 80% of type 2s suffers from sleep apnea, and even up to 50% of type 1s. So actually medical conditions on top of just, these different issues. So
yeah, I was surprised at that statistic. I just want to say kudos to you, because I don't think I've ever heard a lecture in my life, I've been around longer than you, on sleep problems in people with diabetes. So this is an important presentation we're doing for you today.
Well, thank you, Steve.
Try to stay awake.
All right, so why is this an issue? Well, just think about you. If you're watching this and you have diabetes, or your spouse, they could probably tell you too, or significant other, why you have issues with sleep. Let's go down the list. So first of all, maybe the one that comes to mind immediately for me is low blood sugars. So I wear a continuous glucose monitor. It's obviously a problem for a lot of type 1s, but even type 2s, you're on insulin or some of these sulfonylureas medications that cause low blood sugar. Hopefully it wakes you up because you just don't feel well, but you might be wearing a CGM that's alerts and alarms. And here's the other thing. You wake up with a low blood sugar, hopefully. It's not just like you wake up, you treat it, you go back to sleep. Usually you get out of bed, you eat a bunch of stuff. It's not good for your teeth, by the way. Probably extra cavities from these things you eat.
Yeah.
Then you rebound high, like I said. So what about low blood sugars?
Yeah, you know what? I think it goes both ways, because we've been trying to get our time in range, whether you have type 1 or type 2. The percent of time between 70 and 180, and you have these alerts and alarms. They're our friends, but sometimes we want to choke the alerts and alarms. And even though it may prevent you from getting low, it wakes you up. And some of my friends say, I wake up, I have such a hard time getting back to sleep. For me, I'd say I can fall back to sleep pretty quickly.
Yeah.
But getting low, especially to the point of sweating, perspiration, heart palpitations, it takes time to get back to normal.
And, I don't know if you guys know this, but people with diabetes are particularly prone to low blood sugars at night. Our ability to kind of fight back to, counter-regulate is been shown to be less at night. So there are reasons that people are even more susceptible to low blood sugars at night, can wake you up. All right, so on the flip side, your blood sugars go high. And maybe that causes an alert to go off, but if you don't have a CGM, just being high, especially for a longer amount of time, can make you have to go pee. So you're waking up to go to the bathroom, you're maybe a little bit thirsty.
Drink fluids, water.
And then that can be kind of multiple times a night. So if you're low, you're waking up. If you're high, you're waking up. We've mentioned several times the alerts and alarms with your low, your high. The worst is when you're like skirting, like just on let's say you have your high alarm set at 160. It alarms if you go to 160, but then if you go back to 159, it kind of resets. And 5 minutes later, if you go to 160, it alarms again. So it can be multiple times over and over, and you literally just want to just like throw your freaking CGM or whatever.
There are CGMs where you can have a second set of alerts and alarms. You put in the time you want to start and at night and what time you want to end. And so a lot of people will make their levels higher at night.
So don't worry, we have what to do about some of these things. So this is just like all the crappy stuff first.
Okay.
So
sorry.
Other tech issues, if you're wearing a pump, I've had multiple times where the battery's going dead in the middle of the night, or you need to change your insulin out because you're out of insulin, your Omnipod starts squealing at you, other kind of tech issues. And then some kind of complication related stuff. Some people can have neuropathic pain that usually starts in your feet with kind of pins and needles feeling. Again, for whatever reason, worse at night. So it can really make it difficult for people to go to sleep. It can wake you up if you have a particular bad issue. These can kind of come and go, be worse, sometimes and better than others.
Yeah, and well said. I think during the day, these feelings might be, sort of, you don't think about it much because you're busy, you're running around. But at night, that's when it really comes out. And some people have problems with the sheets bothering their feet. And you can get a metal bar that goes at the bottom of the bed that keeps the sheet above that. So those are more advanced cases, but peripheral neuropathy will mess with your sleep.
And then you also mentioned gastroparesis, which is basically your stomach's not emptying the contents as quickly as it should. So it kind of hangs around there. It can make you nauseous. It can make your blood sugars spike up later. So you can wake up in the middle of the night because you're nauseous or blood sugars are high. Another issue. Sleep apnea, we already mentioned. This is essentially an issue where airways get closed at night. It can lead to kind of snoring is kind of the mild version, but actual episodes of apnea, meaning where people actually stop breathing. And then you can kind of all of a sudden gasp, like a big gasp of air. It might not actually, you might not realize it, might not wake you up. Usually spouses or significant others are the ones that report it.
Exactly.
Like, oh my God, like my husband or wife, it sounds like they're gonna die in the middle of the night. And the list goes on. So each one of these things is a very real, very common problem with diabetes. So it's no big surprise that this sucks.
Yeah, and sleep apnea, anybody can get sleep apnea. If you're overweight, if you're thin, if you're type 1 or type 2, that's important to know. And we'll talk later how to address it. I'm not going to do it earlier.
Thank you, Steve. So, and that's a good point, though, that type 1s, even when you look at people that are kind of the same weight as them, type 1s have a higher risk of sleep apnea. So there's something about having diabetes in of itself that may not be related to weight that can predispose people to sleep apnea. So add it to the list, as we always say.
Is there anything we don't get?
Yeah. We don't get wrinkles. That's one thing that we talked about. We have less incidence of wrinkles, maybe because the blood sugar just keeps our skin a little bit, smoother. So you can zoom in, like freeze it and zoom in on our faces and see what you think.
Yeah, I'm 95.
All right, so it's common. We talked about some reasons why it happens. Why do we care? Well, first of all, everyone will tell you just not sleeping, you feel lousy the next day. But when it comes to actual kind of like concrete medical problems, there's a long list. So the issues are when you have poor sleep, it can mess up your hormone levels. When you have these apneic episodes, if you have actually sleep apnea, every time you're waking up or you're not breathing, it's almost like you're dying, and your body starts releasing all this adrenaline, these catecholamines that can increase your blood pressure. They can make you a higher risk for arrhythmias, heart disease.
Yep. And also, for those of you with type 2, we always talk about insulin resistance. And it could definitely make insulin resistance worse. And not to jump ahead, once you treat that, those conditions get better.
Absolutely. And as insulin resistance, they've shown that even just one night of kind of decreased sleep quality can make you much more insulin resistant the next day. So your blood sugars might be high. If you're type 1, you might be needing to take more insulin. It's just like, why can't get my blood sugars in range? It might be just because you had a bad night's sleep.
I mean, a healthy individual, when they have a bad night for any reason, they feel terrible the next day. And for us folks living with type 1 and type 2 diabetes, we have so many more things that keep us awake. And a good night's sleep is so important. How many hours are we supposed to get?
Well, again, we'll get to it. So hold tight. I got it all planned out for you.
All right.
All right, so what else? Why do we care? Well, guess what? Again, when you have a poor night's sleep, the next day, you've probably noticed that you can be craving certain foods. Like maybe it's kind of like greasy foods, or I can't wait to get my hands on some, chicken fried steak and gravy, or donut,
Oh,
or
is that
whatever.
why you always order that?
Yeah. And so it can make it really hard to kind of adhere to a diet because your food cravings actually increase. This is a known thing. Yeah. And when you have diabetes, that matters with your blood sugars and your weight, things like that.
I never realized that.
Yeah. So your blood pressure can be worse, your cholesterol can be worse. And then also we talked about just kind of being sluggish, but you can just have apathy for your diabetes tasks. Like, I don't really want to take my medications. I feel just lousy. I'll deal with that later. I'll change my pump later, whatever. You just don't feel like doing anything. So, all right, what to do about it? It's very common, all these different reasons. How can we fix it? Well, again, starting with kind of the concrete medical stuff. If your partner or somebody tells you that you snore, or you notice that you snore, or you're really feeling like fatigued throughout the day, there's no other reason that you can think of why you might be sleepy, get evaluated for sleep apnea.
Yeah. They have pulmonologists, respiratory doctors that specialize in that. And they can do a test on you. They put something on your nose. And they can sometimes even put you in a sleep lab. Probably don't need that.
Yeah.
But I think I just want to emphasize it's way more common than people think. And if you're snoring a lot and tossing and turning and having these periods of apnea, your partner thinks you died for 15 seconds, definitely get evaluated, because I don't think I've ever had a patient that was treated appropriately for sleep apnea and did not feel 10 times better.
Absolutely. And, like you said, it used to be like you'd had to go to these sleep net labs and you had to stay overnight, and who wants to do that? They can do this at home now with these these simple things that you wear. They can give you an apnea index to tell you, one, if you have sleep apnea, but then how severe it is, depending on how many times you're waking up, and then set you up for treatment. So that's one thing. Then for alerts and alarms, if you are on a CGM, you can change these a little bit more than a pump. But yes, look at your alerts at night. So during the day, I have my alerts set, I think, 80 and 160. So I want to be notified, in a relatively tight range. Steve's like 150, so even tighter. But at night, I think it's like 70 to 220 or something like that. So much more kind of wide. Like, don't wake me up unless this is like becoming like a real problem kind of thing. Because if it buzzed at 160 in the middle of the night, I would just, tell my pump to kind of take care of it. I don't need to know in the middle of the night. So definitely look into time, what do they call them? Time schedules.
Time schedules.
Yeah, for your
secondary schedules. Yeah.
Do you use that?
Well, I do use that, and I do the same as you. And the other thing too is if you have a CGM that does not have that, they don't all do, it doesn't take long to go quickly into the settings and just change the high alert from 160, 170 to 240. The sleep at night's important. And then you can always look at your blood sugars the next day or with your healthcare professional over a 2-week period and say, gosh, you're getting high at night. So yeah, you're high for a couple of weeks until you make the appropriate change, like increase your basal insulin or something.
Right. So then some other kind of like modern day solutions. So another reason that we're waking up all the time is our phones are pinging at us. It could be text messages, all these just notifications. You get a CNN alert, or your like some app you haven't used in 2 years notifies you in the middle of the night that there's an upgrade for it. So this drives Steve crazy, but I set my do not disturb every night.
You don't take it off. It's on right now.
It is on right now because of this talk.
It's on when we finish filming.
But I set it every night. So it's just no matter what, every night, it's like from 10 p.m. to 7 a.m. or something like that. But people always say, well, what if like somebody needs to get a hold of me? First of all, we never used to care about this.
They just call me and then I drive over his place.
But people can always like break through that. They can say notify anyways. So I would absolutely recommend doing that. So you're just not just getting these little just like surges in the middle of the night that you generally don't need.
Yeah, totally.
So other things, do all your diabetes tasks before bed. If you know that you're gonna run out of insulin in the middle of the night, for God's sakes, change your pump, take all your medications, do all that stuff so you're not waking up in the middle of the night because your pump like doesn't have enough batteries or whatever it is.
Yeah, if you're type 2 and you're on, let's say, bedtime insulin, basal insulin, do it earlier. It doesn't make that big of a difference.
Yeah.
It's much better than forgetting altogether or waking up like going, oh, I forgot my shot. So, I mean, we all have reasons. Do things earlier, for sure.
Yeah. And then, of course, just overall blood sugar control. This is a whole multiple talks about what to do, but the better your blood sugar control is in general, people tend to kind of sleep better. So if you're hanging out and your A1C is 10, 11, get treated. Like if type 1, tighten up your insulin, type 2, take advantage of some of these medications. The better your blood sugars do, the better you sleep, and then it kind of is a positive kind of like rolling stone.
When your blood sugar is elevated, it's a physiologic response to be thirsty.
Yeah.
So that you can pee out all the excess sugar. And the problem is you're thirsty all the time and you're drinking up till bedtime, and then that causes you to get up just to pee.
Yep.
And I mentioned that in the very beginning of the show, but I should mention it that another reason is for folks that may have a neurogenic bladder or a large prostate where you don't empty your bladder all the way. And that, if you don't empty your bladder, you're going to have to feel like you got to go really quickly. And there's ways to get evaluated for that as well.
Yeah, and that's just a whole nother thing that we have to do with that's outside of diabetes, just enlarged prostate, making people kind of pee more. So treatment for neuropathy. So what do you want to say about if someone says, man, I can't sleep because my feet are burning all night?
Yeah. Well, I feel bad for you because I know it's difficult. And I know you may have had it once or twice very temporarily. I know I have it occasionally, but I also have patients that have it every single night. So it's not in the purview of the show to go through the laundry list of different therapies for diabetic peripheral neuropathy. Everything from capsaicin cream to medications like, Neurontin, and there's a whole bunch. And we always talk about treating peripheral neuropathy as kind of a trial and error thing.
Yeah.
You try one for a couple months, certain antidepressants work at low doses, and if it helps, it helps, and if it doesn't, you go on to the next. And there are some podiatrists that really know these medications well. There's neurologists that specialize in peripheral neuropathy, amongst other things. And you can find a lot on the TCOYD book written by my ex-wife, Ingrid Cruiser, who was a very good podiatrist, and goes through.
Sorry, would you agree? I mean, these meds aren't great.
Well, that's why I said you got trial and error.
Yeah, and so it is a bummer. But some of them can actually make you sleepy, which you can take advantage of. Take them at night to help control some of the pain, and then actually use the drowsiness to help you sleep.
And some of them work in higher doses, but as Jeremy said, there's no holy grail for treating peripheral neuropathy. It's trial and error.
Yeah. What about sleep meds, therapy? Definitely looking into this. We're not experts in cognitive therapy for sleep or sleep medications.
Speak for yourself.
One thing to mention here, though, is alcohol that I was kind of teasing Steve about. So first of all, alcohol can make neuropathy worse. Second of all, the kind of pattern of alcohol at night is if you're, have a few drinks to go to bed, people say it helps me go to sleep. Yeah, it does help people fall asleep. Kind of knocks you out, you fall asleep. But then as the alcohol wakes up, you get kind of a rebound in kind of your nervous system. So the classic thing is you pass out from alcohol, you wake up at 2 a.m., anxious, can't fall back asleep. So, using alcohol to treat sleep is not a good way to go.
How much are you talking about?
I would say if you're having more than like 2 drinks at night, if you're starting in the 3, 4, and especially if you're using it to try to sleep.
Yeah, I hear you. Okay.
All right, so we're kind of ending in then, well, how much sleep should we get?
Finally.
Yeah. I sent this slide deck to Steve like a week ago and asked him to review it carefully. He just never does.
I did.
I made it this morning, I'm kidding. So really there is the sweet spot around 8 hours. That isn't a number that we just pulled out of our, hats or butts. That if you get less than that, like significantly less than 6 hours, you can get into trouble with all the things that we mentioned. And then if you get more than that, if you start getting like 10 hours or more, then you have, issues also. So it's not just like more is better. There really is kind of a sweet spot right around 8 hours. And of course, everybody varies. There are people that need less, need more, but that's kind of, the golden kind of area to look at.
Yeah, I think for me personally, if I can get 7, I function pretty well.
Yeah.
If I can get 8, like on the weekend or something, I love it. And it just makes you just more energetic during the day. And unfortunately, it's a third of our lives that we're not out having fun doing things, but that's how we rejuvenate ourselves at night.
And it is pretty cool. I don't wear my watch at night, but with a lot of these, smart watches now, they monitor your sleep, so you can kind of get into this. how long did I sleep for, how long was I waking up, these kinds of things. So this is something that you really want to tackle, looking into getting one of these wearables so you actually can monitor it to see if it's improving with these like different interventions. But
I think, and sleep is one thing, quality sleep is another, which is what we have been talking about.
Yeah. So anyways, hope you enjoyed it. Honestly, like we really liked putting this together because it's not a topic that we've really done before. And it is super, super important.
I'm so excited.
All right. Thanks for listening. We'll talk to you guys later.
Sleep well.